If your back pain has become so bad that you're contemplating surgery, stop right there. Surgery might be necessary, but before it happens, you need to strongly consider these 4 factors, 2 of which are rarely discussed. I get it, the pain is unbearable and your life is no longer yours, but surgery for the low back should always be a last resort, and many are not informed that there are safer and better alternatives as healthcare technology continues to advance. Many think they've tried everything and are hoping surgery will finally be their solution, only to become one of the thousands every year who now suffer from failed back surgery. Yes, failed back surgery is an actual category that many now suffer from. In this video, I'm going to show you 4 key factors that you absolutely must consider before spinal surgery, whether it be for the low back or neck, 2 factors of which were likely downplayed and 2 of which you were likely never told. Please stay with me till the end, as I'll also discuss a new cutting-edge non-surgical healthcare technology that is helping many avoid surgery. It may change your life. Hi, I'm Dr. Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. Number 1 are the risks that come with any type of spinal surgery. And you'll say, well, yes, I know there are risks with everything. Don't downplay that. A colleague of mine actually opted not to get discectomy done, which is usually a pretty straightforward surgery, because he had a 1 in 1,200 chance of dying from the surgery. 1 in 1,200, not 1 in 12 million, and thought he couldn't possibly risk that for his family. Journal out of the pain research showed back in 2016, okay, that actually showed up to a 74.6% failure rate with surgery. Every year there are thousands of people who have surgery done and it fails. It's what's called failed back surgery. And the risks, they'll just tell you, oh, well, you'll be sore for a while, it might hurt, etc. Those risks go far beyond that. Make sure that you're hearing from your surgeon the specific risks, all of them, and take all of those into consideration versus the alternatives that you have. The second factor that is often downplayed is the recovery period. Everyone thinks, oh yes, you might take a week or 2 to recover. In many cases, those are months, and in many cases you never recover. Consider what is happening in that recovery period. How much drugs, prescription drugs will you need to take? What type of medications, what limitations, how much time will you need off work? How will that affect your inability to take care of your family and so forth? That recovery period for some people becomes very prolonged. Remember, there is an average, but that average is made up because of people who do better and people who do significantly worse. Make sure that you're considering what happens in that recovery period. Number 3, which is rarely, if ever, discussed, is you're never told that it's never one thing. It's one of the key factors in our clinic, and one of the things that we stand by is when someone has low back pain, chronic debilitating low back pain that hasn't responded to anything else, or the same, for neck pain, is what they don't realize is that it's multiple different factors that are contributing to it. In the medical world, everyone wants what's the one clinical diagnosis. So you waited months to get that MRI that told you you've got a L4, L5 disc herniation. Well, the problem with that is I can guarantee you have more than just an L4, L5 disc herniation. Often it's going to be the herniation, plus there's going to be degeneration of the disc, plus there may be a spondylolisthesis. There's certainly probably some type of curvature or pelvic imbalance going on in the spine as well. There may be stenosis. The problem is surgery can only go in and fix one of those things usually. And if it's fixing one and there's 5 different things that are contributing to the problem, well, what a surprise, you're not getting better. So that's one of the things that they never talk to you about. And that's why a good surgeon will realize that and often won't take you on as a surgical case. If they go in and slice off that part of the disc, if it's a disc herniation, but they've not addressing any of those other things, surprised you don't get better. Understand that most health professionals work with blinders on. So that's not insulting any of them. That's just the way we were trained. If you go to a surgeon, they're going to talk surgery. If you go to a chiropractor, they're going to adjust you. If you go to a massage person, they're going to give you a massage. Go to a druggist, they're going to give you a drug. It's like a racehorse with blinders on. They're doing the one thing they do. The problem is the human body doesn't work that way. Almost always, you have 4, 5, 6 different things that are contributing to the problem. You need to address all of them, and surgery often fails at doing that. And the 4th thing that your surgeon will rarely talk to you about is scar tissue formation. So understand, when surgery is performed, there needs to be some scar tissue formation to actually heal the wound and heal the area. The problem is any honest surgeon will tell you there's no way they can control the amount of scar tissue formation. So if there is excessive scar tissue formation, that is just going to scar to that same area, to the same nerves, to the same discs, to the same joints, to the same muscles, and often cause dysfunction in there. And then how do they deal with that? They go back in and do another surgery. The only problem with that is that creates more scar tissue formation. So going in to clean up the scar tissue rarely works, because then more scar tissue is formed. It's one of the reasons why Tiger Woods on, I think, surgery number 6, when you get to that point, you have a 10% chance of success. So have a serious discussion with your surgeon about scar tissue formation. Understand that is going to be a factor, another reason why there are so many cases of failed back surgery. And as promised, our bonus, there is new healthcare technology. It's what we call non-surgical robotic laser spinal decompression. There are only 12 clinics in the world that have this. We would be one of those clinics in Ottawa, Ontario, Canada. It is a non-surgical form of care. There is no downtime. There are none of the risks that you get with surgery. There is no prolonged recovery period whatsoever. You, in fact, get to do your normal everyday living while this happens. It is the first and only system, patented system in the world, that combines spinal decompression with simultaneous Class 4 robotic laser, which is the highest level of laser approved by Health Canada and the FDA. What that combination does is it allows true spinal decompression to happen, which creates that vacuum effect that will pull nutrients and fluids back to the disc. It actually allows discs to recede. We see improvement in spinal stenosis and sciatica, in degenerative disc disease, and disc herniations and disc bulges, and in fact, even in failed back surgery, even if you've had a segment fused, we can't decompress the segment that's been fused. We can certainly address the other segments that are suffering from the same fate, and will just in fact end up in the same position as well. So non-surgical robotic laser spinal decompression, cutting edge new technology that is literally changing people's lives. If you found this video helpful, please share it. Please share it with people, especially those that you know who are contemplating surgery. It's never too late, and again, surgery should always be a last resort. Please share, please like, please comment, please give us your experience. Please subscribe if you haven't done so already. Please go watch this video next.